Welcome and thanks for being with us today. This webinar, next slide, please. This webinar is hosted by the Mary Ann Swetland Center for Environmental Health and its partners to expand fruit and vegetable incentives and produce prescription programs as part of the Cuyahoga County Board of Health's nutrition strategy for the REACH grant. Next slide. My name is Kim Hines. I am a co-director of the North American Food Systems Network, which is a professional association for people just like you, just like me. As a food systems professional, I led the start of the first produce prescription program in Georgia with partners at Wholesome Wave, Georgia, back in 2015. It seems so long ago. And in fact, that program, while I no longer live in Georgia, that program remains strong and it's now in its 11th year. Next slide. For clarity's sake today, please know that I will use these terms interchangeably. Produce prescription is the same as PRX today, and food as medicine is the same as food is medicine for today. Food as medicine is an umbrella term for a variety of healthy food healthcare interventions, including produce prescription programs. So here's our overview today. What we're going to do is we're going to look at a little tiny bit about what and why. I'm going to assume that most of y'all know what and why here. We're going to look at the history, our shared history therein, and how far we've come. I'm going to talk at length and we're going to combine the conversations about what funders are saying about where we're at in funding produce prescription programs, what's happening in Ohio and nationally, and a little bit about what funders, what what specific funders may be of interest to you at this time and place. At the end, we're going to wrap it up with a little bit of a look at Cuyahoga County at an opportunity crossroads. And then there's going to be time to reflect on and connect and talk about next steps with you as a community. I really want to keep this conversational, so please don't hesitate to ask questions aloud or in the comments, in the chat, whatever. We've made time today to make this interactive, and I encourage you to lend your insights to the ideas that I'm sharing with you today. These are only ideas, right? I'm one person of many, many incredible people doing the good work of promoting produce prescription programs. If you haven't already, please add your name, your location, your affiliation, and a bit about your interest in PRX programming in the chat. It helps me to know who's here so I get a better understanding of how to cater to your interests today. So, what are produce prescription programs? They are healthcare interventions that provide patients with prescriptions for fruits and vegetables, fresh fruits and vegetables. And these programs improve access to healthy foods for individuals who face nutrition insecurity and or have dietary related health conditions. These programs have three essential parts. There is the prescription part, where healthcare providers assess patients' needs and prescribe fresh produce. There is the access part, where patients receive prescriptions to purchase or receive fresh fruits and vegetables, often locally or regionally grown, and ideally, participants participate in. Participating patients have the autonomy of choice from a wide variety of seasonal foods and consumption, where patients use the produce to make nutritious meals supporting better health. Please note that opportunities for innovation still exist at all 3 points here, and that's where the nuance is. That's where the nuance happens. That's where the opportunity happens. Next slide, please. Why do communities invest in produce prescription programs? It's commonly understood that PRX programs address food insecurity and nutrition as social determinants of health. Additional benefits are often layered within this model for individuals that can include social engagement, cooking education, including culturally relevant meal making and food shopping choice making. From a systems perspective, the PRX model also benefits a community by strengthening multi-agency collaboration and local food and regional food economic development. Next slide. PRX programs are also evidence-based designed, and this slide points to several well-known research studies on PRX programs as healthcare interventions. Many more studies can be found online. So to help me better understand where you are as participants here in where you are in this shared journey of developing PRX prescription programs in Ohio communities and perhaps throughout the United States, please fill out this poll in the chat. I'm just trying to get a sense of whether or not you're new to this or you've been around this topic for a long time. Interesting. Interesting equal mix of not familiar at all, somewhat familiar, and very familiar. Thank you. That's really, really helpful for me. Wonderful. All right. Next slide, please. How did we get here? What's our shared history? And when I say shared history, I'm not talking about things that other people did, although other people did do a lot, but I'm talking about what people in your own community, people that you likely already know, spent years doing to get where we are today. These efforts can be tracked back nationally as far back as the 1990s and 2000s, and they ramped up by Farm Bill allocations in 2014, and then they were further bolstered in the Farm Bill of 2018. Organizations like Wholesome Wave, and more recently, the Nutrition Incentive Hub and the National Produce Prescription Collaborative have led the way nationally. But it's important to note that much of this work has been and is hyper local in leadership and substance. That fact is both its charm and its challenge. And that's not going away, and it shouldn't. In my experience of the movement, farmers markets also contributed considerable time and talent to the social infrastructures of these programs as they emerged. For example, the program that I coordinated in Augusta, Georgia, coupled SNAP Ed cooking programs at farmers markets with PRX participant engagement for years. Rest in peace, SNAP Ed. Speaking of which, I want to allow me to a minute to address the elephant at large with us in this room. Funding PRX programs has become harder, not easier. Pilots are easier to fund than ongoing programs, which is where we're at today. Innovation was easier to fund than stability. Disruption is more fun than systemic change. But that's where we are in the movement today. And our work is made harder by existing and proposed federal cuts to SNAP, Medicaid, healthcare research, urban agriculture, etc. Funding our next steps will take all of our talents and collaboration to the nth degree. And we are entering a new era of organizing to fund what we know works. Next slide. Funding wise, where have we been? Historically, produce prescription programs have been funded mostly through philanthropy, USDA grants, short-term food access initiatives. Shout out to those people who made that happen. Most funders primarily focused on produce vouchers, food procurement, such as patients purchasing food at farmers markets, or food redistribution, such as patients receiving tailored boxes from food banks and pantries, and engagement and education. Next slide, please. Highly engaged PRX programs have shown to be consistently effective at improving health markers, biomarkers, and health measures, quality of life. In other words, when it works, it works. Next slide. What else did we learn? The current financial model funding these programs is not sustainable. Small scale pilots and short-term funded programs are very limited in their ability to affect systemic change. Next slide. And together with our funders, we also learned that patients may be prescribed fresh produce, but still fail to engage because of transportation barriers, mobility limitations, scheduling conflicts, healthcare navigation issues, and food procurement gaps. In other words, our human determinants of health are inextricably linked. And side note, PRX innovators who focus on problem solving these known shortfalls right here in this slide may find funding opportunities outside of the common places where we've been looking and where we've been successful. So take a moment to think about where your own ideas and innovations might overlap with funders who come out of these areas instead of the ones we've been looking in so far. In short, healthcare systems, including funders, increasingly recognize that food alone does not produce long-term outcomes. Operational systems produce outcomes. And this is why the funding landscape is shifting. Funders increasingly want to support implementation systems, care coordination, it's the big one, workforce infrastructure, and healthcare integration. They like PRX programs. They don't like the business model behind it at the moment. The strongest future funding opportunities are not likely food charity grants. They are healthcare transformation investments. So, what specifically are funders saying? Funders with interest in food as medicine programming seek to help evolve PRX programs and other such interventions from their current form as small scale food access pilots into operationally sophisticated healthcare infrastructure. For this webinar, I interviewed representatives from two Cuyahoga County-based philanthropies, one Cuyahoga County-based nonprofit leader, and one national philanthropy. I also read articles and reports from dozens of food as medicine programs and advocates, including other philanthropies throughout the United States. And I have been tracking this issue for quite some time because it is just a personal interest of mine. Personally and professionally. I have summarized their thoughts today and gathered them into themes. I'm going to keep them anonymous. And so when I'm talking about funders in your community say, what I mean is perhaps one funder said it or more than one funder said it. All right. So let's look at what they said from an opportunity perspective. My goal here is to help you as program leaders and future program leaders navigate where your own aspirations and expertise may help funders accomplish their priorities. In other words, today we're going to think like funders a bit. Okay? All right. This slide. First bucket, first theme. Funders in your community seek to improve maternal health. Funders in your county are committed to reducing health disparities, and that is not new, and it has always been the case for support for PRX programming. What is relatively new, both locally and nationally, is PRX programming as a preventative intervention for resource-limited pregnant women. In fact, there is now a national surge of PRX programs focused on maternal health for those who are Medicaid eligible. Some funders in Cuyahoga County share this priority, which makes sense as infant mortality is 43% higher than the national average in your community and even higher for African American families in your county. Your neighbors in Dayton are a good example of this trend to match produce prescription programming with maternal health care. They already have the Dayton Children's Hospital Food Script Program that allows physicians and staff to write food prescriptions for hospital patient families who have been identified as food insecure. They run it in partnership with their food bank and support from corporate fundraising partners, including Rite Aid, Walmart, and Sam's Club. I want to make sure that you know that when I say like these different funders, I encourage you to like jot that down. Every time we talk about a funder, it's an opportunity for you to go look and see what they're funding along, in within this theme, who they're funding, and what their requirements are. The federal government is also leaning into this priority. On May 29th, as you can see in this graphic, it is expected that the U.S. Department of Health and Human Services will open applications for their brand new maternal produce prescription program called MP3. It will award a total of $13 million for up to $5,000 each with no cash match required, which is a big deal. The turnaround time on this grant application will be very quick, with less than 30 days to apply. And approximately 26 awards will be granted, which tells me that most of the awards will be on the high end of that cap. As a side note, a couple of other philanthropies to consider within this theme of maternal health. The Kellogg Foundation accepts inquiries on a rolling basis for its Healthy Kids and Community Civic Engagement grant applications. They seek to support efforts to address food insecurity challenges for children and transform food systems to better serve communities, farmers, farm workers, businesses, families, children, and our natural environment. So keep them in mind as one of the larger funders in this space. Elevance, which has invested heavily in your area, has focused its grant making efforts on partnerships and programs that can demonstrate measurable and positive change in four key areas, including maternal and infant health. Applications are open now on that focus area, and they're due July 31. I don't think I'm going to get this one right because I'm not familiar with this name. Lou Britzall Foundation in your community align their giving pillars with several of the United Nations Sustainable Development Goals, including zero hunger and good health and well-being. Applications for their next cycle are due June 30th. So lots of bigger ones coming up. All of these particular funders are not going to likely fund small scale, but they're going to fund where you have already existing collaborations and where you're ready to you're ready to get moving or to scale. So here are my questions for you. All right. Where could your expertise, your knowledge, and collaborations merge PRX programming with existing maternal health programs in and around Cuyahoga County? What existing healthcare infrastructure for expectant mothers could be layered with the additional benefit of a PRX program? Who do you know providing maternal health care? Do they already know about this grant opportunity? And what unique challenges would need to be addressed to make PRX programming successful for pregnant women and their families that you could fulfill with your talents and experiences? Who's applying, right? Who's applying for this? And where could you, with your existing relationships and hopefully new relationships, get written in as collaborators on these grant applications? Now, I'm an ideas person, so I always have ideas that come to mind for where kind of newcomer could fit in. Things like online veggie center, maternal health cooking classes, safe, uniquely equipped transportation services to get pregnant moms and their kids to attend, socialize at, and redeem their weekly food prescriptions at farmers markets. PRX programs designed to grow with the community for through a child's first 3 years. Those are my ideas, but that's not what's important here. What's important on the next slide is what comes to your mind. I encourage you to put those your ideas on maternal health care and PRX programming in the chat to see if your ideas spark any interest among others in attendance with us today. I'm going to give you a minute to think aloud or in the chat about where you could fit into that theme, and I'm going to take a drink of water. Great. April's on it. Yep, Lindsay's on it too. So there you go. I don't know if April and Lindsay know each other or even if you live in the same community, but those are the kinds of connections that we hope to spark today. Anybody else? We can produce to expectant moms. There you go. So there are ideas here. And when you're writing your ideas, it might help for you to write where you are. Yeah, where are you? Because we do have participants here from throughout the United States, and not just your county. So let's make sure that you're connecting with people with whom you can work. All right, slide number 23. We're going to go to our next theme, what funders are telling us. Funders in your community support collaborative health policy advocacy in Ohio, or they seek to support that. They express interest in supporting efforts to mobilize changes to Ohio's Medicaid reimbursement plan to pay for, among other things, PRX programming. Other states have done this, including California, Massachusetts, Michigan, and Washington, and others. And while, let's be honest, states are being challenged by proposed federal cuts to both Medicaid and SNAP, the opportunity to advocate for the most effective uses of Medicaid monies does exist. Funders in Cuyahoga County see that funding will be needed to increase advocacy at the state level in Ohio. For this reason, funders in your community are open to education to help them better understand how to support health policy advocacy. Okay. Next slide. Remember that your connectivity is valuable and it's absolutely necessary for advocacy work. I'm going to tell you a story about my New Jersey colleague, Mandy. I was on a leadership call for our organization on Monday, and we're all just sitting at our Zooms, but not Mandy. Mandy was walking up the steps of her state capitol in Trenton, New Jersey, because she is a member of the New Jersey Food Democracy Collaborative, a statewide food policy council, and they were right there on their state capitol steps gathering together to talk about very similar themes as we're talking about right now with their state legislators. That's what needs to happen. And that is what some funders in your community are willing to support or get involved in, or at least better understand. Community mobilization for change is fundable. Unfortunately, not fundable enough, but it is fundable. And this is especially true today as federal funding cuts and changes increase the need for state governments to step up and resident activists to make sure they do. For example, Trust for Civic Life grants focus on organizing for the benefit of rural communities. The Ben and Jerry's Foundation funds community organizing for social justice throughout the United States with awards of up to $30,000. Do you see advocating for PRX programming to be covered by Ohio Medicaid as part of a social justice movement for your community, for Ohio? If so, perhaps this grant is an opportunity for you. This guidebook on the left, Mainstreaming Produce Prescription and Medicaid Managed Care, which was published in 2023, is a fantastic resource for those involved in the advocacy for produce prescription healthcare infrastructure. Another action I'd encourage you to look at if you're interested in and are already involved in policy work is to join the Food is Medicine Collaborative of Ohio. My understanding is that it involves filling out an interest form that is open to all. Individuals are welcome, and those representing organizations or agencies, the collaborative encourages limiting representation to one person per entity. I don't have a link to that, but we can get you one. That is a really good first step in advocacy work or an advanced step in advocacy work, quite frankly. Next slide. My question to you. Where could your expertise, knowledge, collaborations, relationships, and storytelling help funders succeed in their priority to advocate for Ohio Medicaid reimbursements to pay for PRX programming and other food as medicine programming? Are you already involved in state policy advocacy? Do you or do you know people who build relationships with state representatives, join advocacy coalitions, testify on legislation, and stay informed through action alerts? Perhaps you sit on your local food policy council or other coalition. If so, how can your efforts advance funders' priority to include PRX programming as Medicaid covered in Ohio? This topic is much more complex than I'm making it out to be here, and I really encourage you to go read up on those changes that would need to be made in order for that kind of Medicare reimbursement to happen. Um, but I just pointed out to you as an opportunity to fund action, to fund mobilization, to fund policy advocacy. Put your ideas in the chat on this matter to try to spark interest from others. Are you already involved in this kind of work? In this kind of advocacy? Do you want to become involved? If you're already involved, is there an invitation that you could extend to others to get involved? And what is your unique skill set that you could bring to advocacy? Are you a storyteller of PRX programming? Because that is fundable, right? Are you someone who wants to address one of those gaps those known gaps in PRX programming that we talked about before? And how could advocacy help to start helping other people understand what kind of support is needed to do that? Oh, did you all see this? Maddie's comment about piloting home delivery to pregnant and postpartum individuals in Lorain County. Very, very cool. Great. Thank you, Shane. Thanks, Jamel. Advocates in the room. Shane, if you have a link that you could share for registering for that, if it's still available, I may have heard that that's no longer available for the May meeting, but maybe for a future meeting. Thank you, Jessie, or Jess, if I said that wrong. All right. Thank you all. Slide 28. Ohio is a leader. Oh, I'm sorry. Ooh, I messed something up here. There we go. Funders in your community seek to strengthen program continuity, including workforce infrastructure. Gaps and shortfalls in funding significantly hinder your community's ability to hire, train, and most importantly, keep qualified personnel running PRX programs. It's just flat out true. I know. I had to, with short-term funding, you train and then you lose people after 3 years who are really good at this work. Moreover, healthcare payers increasingly recognize that the engagement infrastructure may matter more than the fresh produce itself. And that speaks to only one thing: human talent. One of the areas where I see real promise is in professional development for community health workers to train in PRX programming. I'm going to tell you about another one of my friends, this one in North Carolina. Kenya is in Charlotte and is head of the Food Policy Council there. Kenya is also very involved with the community health worker community in their training and whatnot. And I remember Kenya calling me on the table one day. She said, Kim, the community health workers I know spend 90% of their time connecting families, food insecure families, to food. She said if a community health care worker has a list as long as their arm on how to connect, where families can find food in insecure situations. But these community healthcare workers are rarely brought into the conversations around food systems development. Kenya's message, that was years ago. Kenya's message just like kind of sits in my shoulder, right, in my ear, reminding me that this very role, these very people who are already doing this work need to be brought to the table and invited to hear about what they already know and involved in the design, perhaps, of PRX programming training. Next slide. Oh, Amanda, very cool. Very, very cool. Ohio is a leader in community health, worker Medicaid reimbursement. In other words, your state already has a system for covering some costs of training, certifying, and paying community health worker services. Key evidence for this statement includes information from the Academy for State Health Policy, specifically one, your Next Generation My Care expansion. On January 1, 2026, Ohio rolled out the next phase of its Next Generation My Care program to strengthen the integration of Medicaid and Medicare for individuals with complex needs. Your PRX clients, y'all. The plan was to expand statewide by April 2026. I couldn't find if that happened or not. Integrating CHWs into care management teams. Stable certification pipeline. The Ohio Board of Nursing, with its long-standing oversight of CHW certification, has created a reliable workforce pipeline. The Ohio Pathways Hub model continues to be utilized to ensure standardized training and funding. Sustained financial investment. Despite national challenges regarding Medicaid expansion, Ohio has continued to invest in the community health worker workforce, including using MedTap grants and securing significant federal funding, 202 million in 2026 for your rural health initiatives that specifically strengthen the community health worker workforce. And Community Health Workers Center for Excellence says that as of 2023-2024, the Ohio legislature provided funding to further support and standardize the profession. Amanda, it's very cool. We're gonna have to hear from Amanda later. I hope you'll talk about what you're doing when we get to the reflection piece, because there's something there. You also have a Center for Excellence, which is for community health workers, which is hosting their next conference in Columbus this November. Amanda, are you planning to go? I hope so.
I mean, I would like to. I would hope I'd be available. I'm actually looking that up right now.
There you go. There you go. And I hope that you share your interest in produce prescription programming while you're there with everyone you meet. I think there may be real possibility here. CHW roles are meant to bridge the gaps between healthcare and day-to-day life challenges for Medicaid eligible people. And many of these gaps are the same ones that PRX programs have run up against. As far as I can tell, and I did try to do a deep dive on this, as far as I can tell, there is no national training for community health workers in produce prescription program delivery specifically. So, my question to you on the next slide is, where could your expertise, knowledge, collaborations, and professional relationships help funders succeed in their priority to advocate for continuity of food as medicine programs, including workforce infrastructure? Do you know any CHWs working in your communities? Well, you do now because Amanda's here. If so, have you discussed PRX programming with them? Are you connected with people at the Ohio Board of Nursing? Are they aware of the effectiveness of produce prescription programs? Is there any other opportunity to put oh, I'm sorry, I misspoke. Is this another opportunity to put Cleveland on the map as a national leader in PRX training for CHWs? Just a question I throw out there. Any ideas on that? I would welcome. You're just throwing that into the chat. Next slide, please. Theme 4. Funders in your community seek additional evidence-based peer-reviewed studies in PRX programming in your community to help them leverage federal funding for the region. Yes, there is a good deal of research on produce prescription programs nationally, and your county has contributed its share for sure. Funders say that additional research coming from the community would help funders make their cases for investments in your county even stronger. What do funders want on specifically from research? I don't know. This will require your own conversations with funders, as each has a different priority. But one theme does seem true across the board. They look for studies showing evidence of addressing multiple social determinants of health, not just healthy food access. So, where your study, your pilots, your programs are able to address multiple determinants of health, you have a better chance of helping them meet their priorities. Here is my favorite recent research study released by the Rockefeller Foundation in March of this year. Yes, it's very hard for me to hold back my excitement about this one because I come from the ag side of things for the most part. I encourage you to download it for yourself. You can just Google it. But here are some numbers that speak to the case they are making. All right, on the economic impact of local food in medicine. 5.6 billion in potential annual revenue generated for small and mid-sized farmers. 316,000 potential jobs supported when this shift, if this shift is made nationally, and 45 billion in economic activity. Yeah, potential economic activity. If this shift is made, if this reinvestment shift is made. Let's look at the next slide very specifically. We'll look at an excerpt from this report. When states, thank you, Shane. You're welcome, Jess. Here's an excerpt. When states intentionally prioritize locally based providers and food sourced from in-state and regional producers, it can support small and mid-sized farms, create jobs, and keep dollars circulating within communities. At a time when diet-related disease is widespread and family farms face persistent financial strain, food as medicine represents a rare chance to address both challenges together. Those of us, and there are a lot of you in this room, have been doing this. We've been thinking this for a long time. But to have an entity like the Rockefeller Foundation do the numbers for us and then put the highlight on that for us is a huge gift. All right. Furthermore, Cuyahoga County, and this is important, food systems leaders in your community have already established a uniquely strong social infrastructure for purchasing local regional food in your county. In fact, more than a dozen farmers markets and all North Union Farmers Market locations use a shared currency that could easily be enmeshed with a produce prescription redemption system. I understand, truly I do, that costs of local and regionally grown food have typically divided the produce prescription programs from farmers markets in your community, sometimes brought them together, but oftentimes those costs have divided. But this research implores you to rethink that. Where can you rebridge those relationships for the benefit of your region's farming economies? I had the great privilege of attending and helping to facilitate the Northeast Ohio Regional Resilience Conference of about 50 food systems stakeholders just a few weeks ago, held in Midtown. Does Northeast Ohio produce enough veggies and fruit to support a meaningful regional food as medicine ecosystem? I sensed yes, perhaps. But from what I heard in that workshop, it's going to require investment in supply chain infrastructure to support a fully scaled, year-round healthcare integrated system on its own. It's going to take an investment in the livelihood of your region's farmers and food systems developers. Where do your aspirations fit into this vision? Next one. Have you read the Rockefeller Report? Have you shared the report? Will you share it with? What are the farm to FIM numbers for Ohio? Right? They didn't break it down to the state level. Maybe your subject matter expertise can help do that. Who can do that work if not you? Do you have experience to be part of that team? You a researcher, an analyst, an economist, and you're working in your local community? Do you know someone who is? Have you talked with local philanthropy about that specific research? Um, if you're not a researcher, are you in relationship with researchers? And how can your work contribute to insights to help us all better understand how to develop food as medicine infrastructure? That was just one research study, right? There are others making these cases. But share it, just get it out there. Any thoughts on that theme? Because the next one is going to tie it all together. You ready? I love it when it happens. I didn't do it. It just that the universe does it for you. Ohio, yes. Great. We thank you. There we go. Who could say no to that? Next slide. Theme 5, our last theme. Yes. Thank you, Shane. A little extra, maybe even more than a little extra, right? There you go. Funders in your community seek to serve and build bridges with your county's surrounding rural communities. They recognize that your surrounding rural communities face unique and heightened challenges to accessing healthy foods, such as lack of transportation, increased distance from healthy food options, higher transportation costs, and time spent on travel, and potentially limited availability and higher prices on, ironically, non-local items. Your funders are feeling that for your low rural communities, and I want you to hear that. Next slide. In 2022, No Kid Hungry and the University of California published this resource, the Rural Produce Prescription Toolkit. It's a little bit outdated right now, but it can still act as a good initial conversation piece with potential rural collaborators who are not yet familiar with the PRX model. We've likely all experienced whiplash from the quick series of changes to rural healthcare funding. And without teasing out the nuances, which I could never do because that is complex, here are a couple of headlines from last month from funders. One coming from the federal government and one from from an association funded by the Robert Wood Johnson Foundation that could be of interest to this conversation. For example, the Health and Human Services announces that more than $135 million will be allocated to expand nutrition services and strengthen the rural health workforce. And also, I'm sorry, I didn't write this down for myself, but we're also seeing that the Robert Wood Johnson headline says that states are using the rural health transformation program to advance food as medicine intervention. So it's out there, right? One of the biggest developments in support of Ohio's rural communities is your state's participation in the federal rural health transformation program. Ohio received more than $202 million in its first year, that was last year, 2025, for this programming through CMS. This program focuses heavily on prevention, workforce development, behavioral health integration, chronic disease management, regional partnerships, and community-based care models. Okay, so additional support for these efforts. From the philanthropy side, here are a few side notes. The Hearst Foundation, which accepts applications on inquiries on a rolling basis, fund up to $100,000 and grants to direct service organizations that tackle the roots of chronic poverty by applying effective solutions to what they call the most challenging and social economic problems. They prioritize programs that have proven successful in facilitating economic independence and in strengthening families. And their preference is also given to programs with the potential to scale productive practices in order to reach more people in need. We're talking about bridging that rural and urban gap here. Very, very cool. Just we got to hear from you. There's a lot going on in your world right now. Thank you. Shipped 2026 community impact grants seek to support health, food access organizations working to build resilient, self-sustaining food systems that nourish communities for generations, i.e., maybe you can make a good case for farm families. They are specifically looking to fund projects across three impact focus areas: mobile markets, so glad to see that, teaching farms, and food hubs. This may be a match for you if your PRX program includes these types of local food procurement partners, right? Local food distribution partners, local food access partners. Funding ranges from $10,000 to $35,000 and is due this year on June 12th. They are hosting an information session on May 19th to learn more. So all I gotta do is just click that right in. Health Equity currently has an open application for a $5,000 grant, which can be used for healthcare anywhere in the US. The deadline is June 30th. Health Equity seems like a good match to support rural PRX programming, in my opinion, where you can make a good argument for health equity as applicable to your rural communities, as well as your urban communities, and bridging those communities and those opportunities. And let's not forget the suburban communities. Very important. I always forget. You know what grants you're referencing now? So just could you just go back the one slide? You'll see them at the very bottom of the slide. Oh, I'm sorry, Hearst and Health Equity. I think I left Hearst out. No, I did. I talked on Hearst. So those are the three that I'm referencing right now. I got lost too. No worries. I may have said, I actually think I may have misspoke on the Hearst one. And the information session is for the health equity one. No, I'm wrong. It's for the shipped one. May 19th shipped. Got it. Thank you. Sorry about that. All right, next slide. My questions to you. Does your PRX work include and benefit your region's rural communities? If not, is there potential opportunity for it? What overlap and need are you seeing among rural, suburban, and urban communities in PRX programming as they address health disparities, at higher level, at the multi-disparity level? Can these needs be addressed simultaneously? Do your collaborators include stakeholders from rural health and rural economic development? Are you talking with them as well? Any ideas that you might have on this, on these opportunities, on these questions, please put them in the chat. Those are the three kind of broad themes that I heard from the people I interviewed for today. Funders are also very clear about things that never go away, and that will be addressed on the next slide. Funders, for especially for PRX programming, they look for strong, nimble, community-based nonprofit leads, ideally not academic, with program experience and capacity to manage funds for starting and scaling programs. They not only look for, they would require a committed clinical partner for values-based patient care. They are looking for an existing connection to existing food and a framework for ongoing evaluation. And they also look for a braided approach to fundraising for your efforts because no one wants to be your golden goose egg. And this could include sponsors, fees for service, etc. That's not going away. More importantly, and this is the point, they want to hear from you. They want to meet you. A relationship with a funder before a deadline is on the near horizon is what they look for. Reaching out before deadline season to get to know them, and in one case, to co create proposals if that opportunity exists with them. They welcome the opportunity to provide guidance, and they encourage you to follow the directions and follow through with your inquiries of them. But more importantly, it's get to know them and better understand their priorities. My background is in philanthropic studies. I was talking about this the other day, and I wish that I had focused more on the actual the fundraising part of my degree program. But what I did focus on was the relationship building part of it. And I'm so glad I did because the mysterious relationships with funders kind of don't exist for me. I have no problem reaching out and asking for a conversation with a program person at a funding organization, and you should also feel comfortable doing that. That's their job. Community foundations are especially good at this. Like they have the best, nicest people often running these programs, and just knowing them as fellow stakeholders in your community is your first step, right? Better understand what their needs are. Think like a funder. All right. So one more suggestion from your funders. For those new to nonprofit development and fundraising in your county, funders highly recommend joining the Cuyahoga Human Services Chamber. As someone, I've worked in the nonprofit sector my whole adult life. But I can tell you that what your sister cities, including Cleveland, have done in establishing these unique chambers for human services folks and innovators like you is an impressive networking resource that emerging nonprofit leaders throughout the United States need. You're really lucky to have these. So I don't think they're expensive to join. And if they are, find an affiliate to help you join, and get involved. This is where you're going to connect. This is where you're going to understand how the sausage is made in your community. Yeah. All right, so the last slide before we meet you. Your community in Cuyahoga County is at a crossroads, and the region, Northeast region of Ohio, is at a crossroads of decision making. You've worked incredibly hard to build social infrastructure for local and regional food growing and food access. You have one, in my opinion, this is just my opinion, of the strongest in the country. And you've worked incredibly hard to pilot and research food as medicine programming, including PRX. You've gathered together coalitions, you've brought in federal investments, you're involved in Medicaid policy change, you understand participation barriers and workforce needs. Like you got this. So now what? And I hand it back to you. Now what? So we're going to stop sharing and we're going to ask you to just spend the next 3 to 5 minutes reflecting on the what you're thinking about and or what your next steps might be in the chat. And then we're going to open it up to talk. While you do that, I'm just going to go get a drink of water and I will be right back in, yeah, let's say 4 minutes. All right. I think that was about 3 or 4 minutes. Yes. Okay. I'm seeing this theme over and over again, and I've seen this for a couple of 15 years now, that paying for the food and paying farmers for the food is the hard part. But here's the opportunity, right? Where you can leverage Medicaid dollars to cover the cost perhaps of delivery, not delivery of food, but delivery of services, maybe delivery of food, and the cost of the clinical side of things. Perhaps that's where philanthropy could step in, right? With their agility. If they're not paying the whole thing, perhaps using the resources, using the data that we shared today, perhaps a good argument could be made to philanthropy to do that. And we see that that is one of their priorities, to strengthen your rural parts, including your rural economies. So I think it's an opportunity, but we have to frame the conversation in that way with them. Yeah. All right, let's open it up. I don't want to be the one talking. I'm so tired of hearing me. Let's hear what you have to say if you'd like to.
I want to say thank you, Kim. This is a good presentation. And I do want to like just add some like bonus points or tips to that report because I recently just received money, and this wasn't for PRX work, it was for farm to food pantry work. But one of the ways I made a case for like why me buying directly from farmers for these programs is more than just a money drop into my program. It has ripple effects because we're to this point, we're affecting local economies because the local farmer goes to the local vet, the local gas station, buys local feed. And so that money stays here. And in Appalachia, that has not always been the history. So opportunities to like invest in our communities through like financial injections, I think are great. And while federal people don't want to pay for food or they might not care about those larger impacts, my private funders have. And I have been sharing this Rockefeller report already, and I shared it with someone in this thing, an older Michigan State University report about the value of spending in local economies and how it circulates. And so I think that those are key factors to consider when making a compelling case for your program.
Yeah, thank you so much. Shane, where are you then? Where are you specifically?
I'm in Athens County, which is like southeast Ohio, and I do programming in like 9 counties down here.
Great, great, great. Nice to meet you.
You as well.
Did we connect a couple of weeks ago in Cleveland? No.
I feel like I might have seen you on Zoom somewhere or here because your face and voice are very familiar. I also am a talker and I'm in lots of meetings and things, so you may have seen me somewhere.
We must be siblings. There you go. Who else? Who else has insights they'd like to share with the group?
I was wondering about the community health worker piece. I know that's come up in a lot of conversations here in Cuyahoga County with like our produce prescription working group that's focused on like policies that would, whether that's at the city or county level or even within just a specific healthcare institution, like their procurement policy, where they're ordering food from. It could be anything that would support produce prescriptions. So yeah, I think that community health worker piece is so important. And like you said, Kim, that story that you shared, it's like that is the job that they do every day. There's such a like wealth of knowledge and they know all the resources in the community. So, tapping into that and making sure that there's community health workers involved in these programs from the beginning. And I'd like to get, invite more CHWs to join our working group. I know we did have a CHW, Brandy, who co-facilitated the Reach Fellowship last year. And yeah, I think connecting with a few of those like organizations, I'm trying to remember the name of it. If anybody knows, please feel free to jump in or put it in the chat. But it's like a community health worker collaborative or something. They like provide support to CHWs throughout the county. So
Is it Center of Excellence that you're thinking about, or is that something different?
I think it was something different. I'm trying to remember. And I know, like, I think it was Amanda who had put in the chat that she's at the Tri-C Cuyahoga Community College program. I know they have a strong program there, and Cleveland State has a big CHW program too.
Yeah, you know where I would start? I would start by spotlighting what they're already doing. Yeah, they're doing amazing work. When I was in Augusta, Georgia, there was a community health worker who had a friendship with one of our farmers, WB from Brown's Place Farm. And I don't know how it all came about, but she knew that if you came to, to, to Brown's Place Farm with your prescription, they're not going to just double it, they're going to try to quadruple it, right? And so that's the kind of leverage that these relationship building roles can do. It's just one to one to one. Yeah. Yeah. Love them. Yeah, and that's the whole thing. I bet I'm guessing Shane and others, you've seen this as well with your agricultural communities. They're so generous, but they still need to get paid. So if they have an abundance of collards on their hands,
Oh, I think, did you freeze, Kim?
oh,
Are you back? Oh, you're back now.
oh, okay.
Yeah, you said an
Yeah.
abundance of produce on their hands, and then it froze.
Oh, an abundance of produce that they want to distribute. They don't want to be stuck with those collards, but they have to get paid for at least some of it, right? And this, I don't know that the I don't it's going to take that kind of storytelling with your agricultural community to help funders understand the benefit of investing in the food portion of the programming. Yeah. And it shouldn't be like, oh, WB agreed to quadruple the collards every time. It shouldn't be that. It should be, oh, this is the kind of these are the kinds of relationships that often develop when we design around agricultural and seasonal programming. Yeah. The shift is nationwide, I believe. Just I'm sorry if it's Jesse or Jess. I've been I've been calling the whole time, so please forgive me if I got it wrong. Other questions? Um, Another thing that I would point to is the opportunity for current food as medicine programming people who are running programs to become CHWs, right? There's that pipeline too. Like, yeah, you can come that way, but also, oh, interesting. What if we got to know your community and your profession a little bit better and where there is potential overlap there?
Plus, we've just started as far as like gauging community health workers as an opportunity to try to overcome some of the transportation barriers we face in rural America, because that is one of the big things, like getting the people to the food and the food to the people. And so as we like apply for larger grants, we're like writing CHWs into that so that if we get it, we can like reach out to our partners at Hopewell or whoever to like leverage some of that, because we don't have to like I do food access. I connect farmers with like the programs and like help them move the food. So my first goal is like, how do I get money to my farmers? But what we're learning and knowing and research is out there, fresher food has more nutrients. It's more nutrient dense. So the sooner we can get it from the field to the plate, the more effective the treatment or the dose or whatever is going to be. So just another case for engaging our local farm networks.
And it's just more fascinating. Like it's more engaging because it's so interesting, right? All of us love to I'm just going to speak just for myself, I guess. I would love to better understand and be a part of that whole system, including the growing side of things. So, yeah, yeah.
Well, you can even include things like, for a while we were like, we have two programs. One, it's like bulk and people build their own bags, and the other is we deliver bags, and that started during like contactless times of COVID. Um, but we often will include like a here's like the tomatoes this week are from Joe Barr's farm. Here's a little bit about Joe Barr. Here's a tomato recipe. Like just those extra community building pieces that make it like personable and nicer, you know, because it's more than food. We're like giving out love and community.
Yeah. And that's what the research shows, right? Funders know that. It's, yes, it's the food, but it's also the social infrastructure that grows up around it. And they want to fund that. Yeah. Yeah. Anything else that anyone is thinking about? What did we miss? Like, it would be unfair to me to just say, here's a list of all the funders that have or tend to give to PRX programming, because it doesn't work like that, right? Well, the way it works is that you're thinking through what your specific talents and interests and relationships could do, and then you kind of go look for a relationship with funders who could help you think through how that may or may not overlap with the priorities. Funders' priorities change, they evolve. And people like you can help that. You can help that evolution. It's slow and it takes a lot of effort on your part and some time, but yeah, they're people too. There's something called have you ever heard of this one before? The Sustainable Ag Food Systems Funders.org. SAFSF.org. I'm going to put it in the chat for you. Whoops. I'm sorry. I was just sending that to Jess. Let me put it for everyone. SAFSF dot, SAFSF.org. My association is not mine, but the association that I work for is an association of food systems practitioners. I imagine most of you here are practitioners. But SAFSF is an association of food systems funders. And they have a very social justice kind of center core. And it's closed. It's a closed association. You can only join if you're a funder. If you look under their members, you can see who's there. And they are committed as a membership, as a collective, to um, better understanding to their own learning, their improve learning about what's working in community, what practitioners need, what they need to create and affect systemic change. Um, the food system, SAFSF does call, first of all, make sure that you know which funders in your community are in their membership. And if your community isn't represented there, encourage your community foundation or whatever to become a part of that so that they can get educated in all of these efforts, right? And all of these kind of nuances of what's changing, how things are evolving, what practitioners on the ground are saying is needed, and what evidence-based research is saying. More to the point, though, the SAFSF does host an annual event where you can't pitch an idea, but you can you can propose a learning opportunity for them to learn more, so you become the teachers, right? And this is something that maybe your region could do around produce prescription. Like, look at all the things we've learned, and we understand this and this and this. And here's this gap that philanthropy could fill. And maybe it's about the food itself. Yeah, super. All right. Well, I don't really have anything else to share with you today, except for, and so I'm gonna switch it over because we do have some follow-up information. Yeah, take it away.
Okay, pull our slides back up here. Okay, so I'm glad Shane was able to join today as well because he's going to be one of the coaches. That's probably why
Oh,
you're
but okay. I was just like, what? We know each other. Okay, Shane. Nice. Great, great.
Yeah. So through our REACH grant, which funded, this workshop and our other work through our REACH grant here in Cuyahoga County, um, we are offering technical assistance for one-on-one meetings, about an hour long, with one coach. You can also schedule multiple TA sessions. Um, we have more details in the sign up form, which I'll make sure you get that link in the email with all the slides and everything. But really, we're kind of offering three different options. So Michael Walton from Catalytic Change Link and Shane Benton, who's on here from Rural Action, are going to be providing TA sessions. Really, it's kind of like coaching about, designing and implementing your produce prescription programs, establishing partnerships and things like that. And they're also going to be co-leading a two community of practice sessions for folks working in produce prescription programs in Cuyahoga County. On the next slide, I'll have more details about that. And then Kim, who led the workshop today, is going to be providing one-on-one TA sessions, mainly focused on like funding, sustainability, and preparing, the infrastructure in your organization to apply for funding. And then Owusu Yumoa, who works at the Sweatland Center with me, she's our lead research scientist. She will be offering some evaluation and data collection TA session. So if you need help with anything related to, surveys or, tracking, redemption or, program participation or even like patients' health metrics, things like that, she will be a great resource that you can sign up for a TA session with. Um, and then we're offering these TA sessions through August 1st, just with the timing of our grant. It's a little bit rushed, but we want to make sure everything's ready for reporting at the end of the fiscal year. So if you have any questions about the TA, you can email us. When you fill out the sign up form to request a TA session, there will be several options for that you can check as far as what kind of TA, like what topics you need help with. So if you check, funding, sustainability, or evaluation, you'll get a referral to meet with Kim and Wuswa. And then pretty much anything else, Michael Walton and Shane Benton would be your TA person. So we'll follow up with you within a week of filling out that form. And it's pretty quick, but it just has some questions about your organization and your program. You don't have to have a program already. If you're just like thinking about this and you're interested, we welcome anybody regardless of what stage you're in. Okay. And then, as I mentioned, we're going to have two community of practice sessions. This is something new we're starting this year. And we basically, it'll be like an interactive space, kind of like today, very more so like a peer learning space where you can collaborate, share lessons, resources, troubleshoot issues, brainstorm solutions. And really, Shane and Michael are going to be there as facilitators, as guides. So it's not like, they're teaching and instructing and then there's Q&A. It's really like a group conversation, getting to know each other, and kind of learning about each other's programs or, ideas for programs and helping each other, just being that support. And it could, helping each other find funding or other things. So those will be on June 9th and July 21st from 4 to 5 p.m. It'll be virtual. And again, regardless of what stage you're at in planning or already implementing a program, as long as you're, living or working in Cuyahoga County, and you're interested in PRX programs, you're welcome to join. So there is a registration for that, and then you'll get the link to the Zoom meetings. And you don't have to attend both of them. Just, you can join when you're available. Okay. I think that's all we have today, Kim. This is the link to the Sweatland Center's newsletter. And then HIP Cuyahoga is part of the Cuyahoga County Board of Health, who received the CDC REACH grant, and then we're one of their sub-awardees. So they're really leading all the social media content on there, so you can get other updates about our REACH grant here in Cuyahoga County. And then if you have anything specific about the PRX, we'll share that link with you, but you can email us at reach@case.edu with any questions. All right. Well, thank you all so much for joining today. I hope this was helpful. We'll make sure to share the contact information for Kim and the links for everything we talked about today. And I know you all shared some great resources in the chat as well. We're going to put the recording on our YouTube channel probably by tomorrow. So if you know anyone that was not able to make it or might be interested, we'll make sure to get that link out to you all so you can share it far and wide. All right.
Yeah,
Thanks so much, Kim.
thank you. It's such a pleasure to be here with y'all today. Take care.
All right. Have a good one. Bye.
Thank
Bye-bye.
you.
See you later, Shane. We'll circle. We'll circle around. Bye-bye.